Hi David.
Hi Vicky.
A routine check for vital signs like temperature and heart rate. Regular updates, often every 4 hours, are a key part of care and safety in hospitals. But patients can deteriorate between these checks, putting them at risk.
Okay, so that's on
Still on
nice and securely.
This private hospital in Brighton has been trialling a battery-powered patch that updates information on some of the vital signs every couple of minutes, issuing an alert if there's a problem. It doesn't replace routine checks, but it does ease some of the pressures.
It gives us a bit more time with patients when we know some patients do need that bit more time. Without this monitor, you're constantly thinking what's happening in the next room, I should go in there and check them. But with knowing this is on and it works well, we are able to spend that bit more time. It's just a bit more relaxing on the nursing side, knowing that your patients are being monitored.
It gives me reassurance that there's something or some equipment looking at it all the time. And I think when a nurse is with you, her mind's perhaps a bit more with you rather than thinking about what's going on in the other rooms.
This is what continuous monitoring looks like in the NHS at the moment. It's extremely expensive, very restrictive for patients, and there needs to be a nurse here the whole time to keep an eye on what's going on. With this patch though, it's so small and light, patients can get up and move around, so they're less likely to develop complications, and that means they're likely to recover more quickly and go home sooner, saving on the costs of care.
You've had this before, so you sort of know what we're doing with it, don't you?
This British-designed patch lasts 5 days, long enough for most hospital stays. It's being developed to provide more information on blood pressure and oxygen levels. Independent experts say it has great potential for a lot of different settings.
This could certainly have a use in the emergency department and from the emergency care phase right through the first couple of days in hospital when the patient is more liable to deteriorate. It also has potentially an application for looking after patients in their own home because we could observe them remotely rather than observing them in hospital.
The patches are about to be tried out in the NHS. The company says it's in talks with 20 trusts. The Royal College of Nursing says anything that helps pick up deterioration early has to be a good thing. But it says it's still vital to ensure there are enough staff with the right skills on every ward. Adam Brimelow, BBC News, Brighton.